welcome once again to your #1 show, Healthzone on Bina TV. As part of World Bipolar Day celebration, I have in the house today Dr. YENNUSOM MAALUG, specialist psychiatrist from Pantai Hospital, to talk to us about bipolar disorder. Welcome, Doc.
Thank you very much. And thank you for having me.
We are most grateful to have you here. Tell us, what is bipolar disorder?
Okay, thank you once again for the opportunity to help create awareness on mental health. Bipolar disorder is actually a mood disorder. And when we say mood disorder, I mean it affects your feelings, the way you feel, your mood. And it can present in one of two ways or two extremes. Either you having a very high mood, being hyperactive, restless, agitated, you having a very low mood that we refer to as the depressive phase, being very down, sad, withdrawn, not wanting to interact with people, some may even become suicidal. So you can have a period whereby you have a very low mood depression, and you have a period whereby you have a very high mood, which you refer to as mania. Okay. So that is essentially what bipolar disorder is. So it's a mental disorder.
Oh, okay. So can you tell us who is predisposed to getting this condition? Who can get bipolar disorder?
Bipolar disorder, like any other mental disorder, the exact cause is unknown. You know, we usually say there are risk factors, biological, psychological, and social factors that could contribute to one getting it. It tends to run in families. So if you have a family member who has got bipolar disorder, there's a risk of you getting it as compared to somebody who doesn't have it in their family. And like all other mental disorders, the other social factors could precipitate it in somebody who was vulnerable to it, you know. So we can all get it, but if you have a family history, you are at risk of getting it.
Okay. Do children suffer from this condition?
Bipolar tends to occur mainly in teenagers or older children. However, it may occur in children, but even with that, the diagnosis might be a bit challenging. But it tends to occur in older children and teenagers.
Oh, okay. So, Jama, assalamu alaikum. Sanu kudayini. Munda umukukuma de shirumu Healthzone come Bina TV. The manchenga monka specialist psychiatrists from Pantai Hospital. Sunenshi Dr. YENNUSOM MAALUG. Munzo muifira ni bagabatun bipolar disorder. She indicate tambaye she miyake che ma bipolar disorder. We mood disorder ni. Mood bi mana yenda mutum ke feel cikin zaman shi. Da inde disorder yazo jiki she ya zama problem daban. Na tambaye shi ya abin ke yi. We okay. Mu doke shi kaman mutum na at one moment she me shi yazo yayi down bi magana da kowa ya ja kan shi. The next moment, when I classify one as depression, the next moment, she may she kuma yazo ye high mood, mania. It's a case of kana zo wanda wani, baka gani yenda me she yake ba. One moment me she na diarrhea da kai yana okay. The next moment, mood me she ya sake. Really wannan mutane, some of them, ana ya diagnosis kamar suna da bipolar disorder. She na tambaya kamar wasu wada wake wana abu ke ya cause wanga bipolar disorder nga ke bar ya faru ce so dai yana running in families inde kana gida da kana da relatives da ke da shi, chance of getting it is high. Ya fi wanda bai da ba shi cikin line shi ko ba shi cikin jinin shi amma ma yana afku. Shi na tambaya yana samun yara sai ce wai yara da bai samun su too often amma bai ce wai bai ya samu amma yana samu. You said older children.
Yeah, yes. I mean teenagers, early adulthood.
Adults.
Yes.
Yasa takaice maganar duka kenan zamu continue the theorem. So, Doc, how would you know if someone close to you is suffering from bipolar disorder? Because as for mood changes, we all have mood changes at one point in time or the other. I can be sad now and then something else will make me happy later. So how do we know, how do we recognize it?
So I mean, if somebody has got bipolar disorder, like I said, it can present with either the depressive symptoms or the manic symptoms. So For mania, usually the person will be hyperactive, very irritable, could talk excessively, decreased need for sleep, maybe hypersexual, gets involved in casual sex, or gets involved in activities without recourse to the consequences. Can just meet a lady right now, want to sleep with the person, doesn't even care whether it's used protection or not. Can just pick a cab, driving reckless, doesn't care about the consequences. And they tend to talk big, grandiose, you know. And, you know, they have something called infectious gaiety too. The least they can say and make everybody laugh. The least they will make you laugh, you know. So all this, and they're also distributed. They can talk explicit into things that, you know, they should talk and get yourself, but then they will talk in details explicitly, whether sexual, whether personal issues, you know.
They have an idea of everything.
Yes. And so that's for the manic phase, you know. For the depressive phase too, I mean, just like the symptoms of depression, they are down, they are withdrawn, they don't want to do anything. Some may have crying episodes, suicidal. But for you to know whether the person has got bipolar or not, it can be challenging if this is the first presentation. But when you are taking the history, you find out from the person, if you are, let's say you are a doctor and you take the history, find out whether there has been a previous episode of such a behavior in which the person was hyperactive or aggressive or had a high mood like that. So if the person presenting with a depressive symptom. But if the first person presenting with just depressive symptoms and then you ask and then there's no previous episode of having a high mood, hyperactive, irritable, talking excessively, then you can make a diagnosis of depression. But if the next time the person presents an episode, you realize that it is of the manic type, then you can conveniently say that this is bipolar disorder, you know. Or if the person presents with a manic phase, manic symptoms first, and subsequently gets well and then has another presentation like that, then you can see this is bipolar. So depression and bipolar, they are all mood disorders, but you can have depression present in bipolar.
Okay, so do such patients get aggressive, those with bipolar?
Yeah, so for the manic type, they are hyperactive, and they have this high energy in them, so they can get aggressive, really restless, and usually we tend to, you know, have to do some form of restraint, chemical restraint, give them medications to calm them down. Okay,
come to the medications in a bit. So let me just go back to my people and do some summarizing. So Jama, yanzu ga na tambaye doctor kaman in kana nan da mutum ko kana nan da mutane, za ka yi ka gane kaman wanda kake nan da shi na yana da wanga condition ga. Don kaman yadda na ce mai, we all sometimes get withdrawn, we all sometimes get excited. Wani ya yana wurin ka yanzu yana jin daɗi, the next moment kaga kaman bai shi yayi sad ko wani abu. So mu duka yana muna yasa in what case za ka yi ka ce kaman oh wangan gade is a problem. Sai ya ce wai yana show in a way kaman me shi kaga kaman yayi hyperactive na meaning kaman ai mu duka muna zuwa up and down muna kuma shi kaga kaman me shi ya samu wani energy yana gidi yana zuwa up and down wani karfi dai ne yazo jikin shi a kaga kaman wanga is not normal don dama ba san me shi da haka nan ba. Me shi yayi irritable wani abu kadan shi yayi fushi abinda bai kai fushi ba shi kaga me shi yayi fushi ko abinda bai kai damuwa ba shi me shi ya damu. With decreased sleep we me shi kuma na zuwa bai yayi kwana kaga da dare ko wani kwana me shi idon shi na bude we the person becomes hypersexual me shi yazo yana so wurin wasan kwana me that's how I call it in Hausa wurin wasan kwana shi ya saura yana ta bin mata anyhow bai damu ba na za yi shi ko ya za yi shi ko ina anytime anywhere tana nan da mishi ka saka mana shi ba haka yake ba. So all of a sudden the person becomes like that where they begin to talk big we ka san mishi calm person ne mishi na magana manya da abubuwa. That is the manic phase wannan ke bar mishi hyperactive nan ka bar wurin kuma shi ka zo wurin the depressive phase wannan kuma shi mishi yayi down and withdrawn shi mishi yazo yayi shirun bai tanka kowa yana cikin kullu yana cikin kubin shi kuma dama an saba haka yake ba. Then wake crying episodes mutumba buga mutumba ba mai komi ba bai samu problem da kowa, and then you find the person crying shi saurayi yana ta kuka, and suicidal thoughts kana nan da wani shi na tunani kamar ya kashe kanshi da ya mutu ma da ya fi, and all those things duka ya gwada kamar wanga abubuwan kana gwada. But even with that, he says when you come to the hospital, do and trace if there has been a previous episode. Yeah. If there have been a previous, when they are taba happen, sannan za ya aduduba wannan duka ya so a diagnose. Me shi nothing be shi do people like this get aggressive, nothing be shi wai da wani mutane nan suna yi su zo idon su yayi jama ya kai kamar za su ji ma wani ciwo, wai yana yi ya kai haka nan. In some cases yana yi kai haka, in dai da manic type ne yana yi kai wannan level. Isa za mu koma mu zo mu tattauna da shi mu ci gaba da firan mu. So doctor, what are the treatment options? Yeah,
but before I speak about the treatment options, for those who present the manic phase, mania, they also spend money excessively, or they are over generous giving out things. So the family member will tell that they don't even want him to have access to his or her account because he will just spend it, go and withdraw and then be buying things that he doesn't even need, so and be given. It's all part of the symptoms of the usual bipolar manic type.
Oh, okay. Yes. So we manic type na yana bar me shi kuma yanzu hannun shi bai da karfi, yana ta cire kudi dai ne yana bayarwa. Abin da ya aje yayi da shi abu. In most times an ya kawo patient shi related to ce wai ba bar ya samu access to his account ma. Don yana cire kudi anyhow, yana use, yana ba mutane, they spend excessively. And to yanzu ga doctor ya ba mun gane kamar duka na cikin conditions. And so when it be by expenditure and they wani normal,
over generous, giving out their stuff,
even the things he owns and he can give it out to people. It's a few examples, Kina. These are some of the things that you can look out for, observe, and someone around you and know things are not too well, so that you know this is time to seek for help and perhaps probably take the person to the hospital. So back to the treatment options.
Yeah, so the treatment options usually in our setting, we say we have the biopsychosocial approach. Bio means biological, psycho means psychological, social of course means social. So biological, we tend to give medications. The medication, we have what we call mood stabilizers, and also antipsychotics. The psychological, we get a psychologist involved, and then we offer them psychotherapy. Some of the clients don't have insight into their condition, or they don't appreciate that they have a problem. So when they are getting well, we let them talk to the clinical psychologist for insight therapy. Social, when we're trying to get them well, we involve the family members to see what are the social interventions we can put in place. If it's at the workplace, if it's at home, we involve the family, involve the work colleagues or the work supervisor, see how we can put things in place, you know, to get him well. And even for the family to know when he's well, they need to continue the treatment, they need to bring for review, and they should also do things that could stress him and lead to a relapse. So in a nutshell, we give medications, we offer psychotherapy, and then we also have some social interventions for the person.
Okay. So when I tambaya batun ya samu mutum ya samu irin ciwon ga ya ake treatment shi she they use psychosocial approach. Biopsychosocial approach. To bio nan ne magungunan the drugs, medications ake bayar wannan. Sai psycho now is way machine sometimes not but machine get psychologist, because sometimes some of them don't actually believe they have a problem, but so you get come it's not one problem, but I don't want to share me psychologist yeah magana da shi. Sai social approach and I involve family members, and do me shi akoma gida the family members zai je zauna yanda za yi mishi ya zo da shanin aikin mishi da kuma yanda za su sa kansu cikin treatment to make sure mishi ya sha magungunan da komi.
And any other social interventions that can be put in place.
Okay, da komi da za yi daga cikin surrounding mishi da gidan mishi da zai bar mishi ya zai comfortable from hospital. So when the person moves home. So how about rehabilitation?
Yes.
Is there anything that has been put in place in this part of our world as far as rehabilitation is concerned for patients like this?
When you say rehabilitation, I mean when the client comes to the hospital, the family brings the person the condition is so severe that we have to admit. It's a form of rehabilitation really to get the person well.
Okay.
When the person is well, what we do is that on the ward, we usually invite the family, we have a chat, update on what we've done for the person, and then sometimes even ask them that to get the house ready pending the discharge. So all these are forms of rehabilitating the person, getting the person back into the society, you know. So we have hospitals that can take them, a client in, when the person needs admission. Okay. And then after that we discharge home. Yeah.
Okay, so how long will such a client usually stay in hospital for treatment?
For some clients, within a week to 2 weeks, they would have settled, then we would discharge. But for those who tend to get well, then they go home, they stop their medication and they relapse and come. Some may stay up to a month or sometimes longer. But within 2 weeks, most clients do settle. And then we then invite their family for a discussion about home and
oh, okay. So is the treatment expensive?
Mental health is actually supposed to be free.
Okay.
The treatment, I mean, it is relative. It is relative. It is not that expensive. It is relative. Depending on the type of medication that we are putting you. But essentially, when you come to the hospital, you get the treatment.
Okay.
Yeah, so it is affordable.
Oh, okay. Okay. So, jama na itambaya kama nje yaka kemishi iri mwanga mutu yaka kemishi hospital. How long ya mishi zeye sauna uri kwana nawa zeye sheche we it's relative, but it depends on yende mishi yake. We want to be 2 weeks is okay. Anaya within bokwa biu. Ayi mishi is stable actually. When it be kuma yana yete har kama 1 month. When it's relative, it depends. Kama yende egwada. Yende abin keima mishi ze egwada. Yenda abubuwa ze ite. Shina tambeto. Shi mwaka kao mishi ya batun kudi yake. Ya whether it's expensive. Shi yeche we mental health is supposed to be free. Ideally. Amata nanganga ana karban kudi kadam. But then big kuma it is too expensive. The buyer. Abia, it is okay. It is not too expensive. I
mean, also what I'm saying is that I mean, the medications are not that expensive, but it also depends on the type of medication that we are putting you on. Okay. You know, where I work, I mean, you have to pay for your medications. So yeah, and it is affordable. Yeah.
Oh, okay. It's perhaps maybe whilst we are home right now, we might have people around us who might be facing some of these things that maybe we've not really taken note. So I'm sure with our conversation with Doctor this evening, we would probably realize that person close by us, that sister, that brother, that auntie, that uncle, might probably have an issue and we would have to visit the hospital. Maybe with the doctor, within a short time, we've learned a lot. So out of these few things we've said, you might be able to observe and then take a decision or observe and know, no, this is not going well with my brother, things are not going well with my sister, my auntie, my uncle, my mom, my dad. So we should take note of this and then watch the people close by us. And if sometimes even ourselves, we are not exempted. So whilst we watch others, you observe yourself too. Perhaps some people don't actually believe they have a condition like that, but it is possible for you to realize it yourself, right? Is it?
Oh, I mean, if you have insight into your condition, I mean, with time, you begin to appreciate, oh, so this is what's happening to me, and I need to take charge of my health. You know, I have clients that after 2 or 3 episodes of, you know, of the condition, now I'm beginning to appreciate that, look, I've got to take my medications, so I'll be well. Because initially, a number of clients don't even understand what is going on. They don't even want to accept that they have a condition. You see, whether you accept or not, you have the condition. What you can only do is make sure that you take you go through the treatment and get to so you can get back to your functioning level. You can be able to get back to school, you can be able to get back to work. So if it happens 2 or 3 times like that, and they get well again, we are able to counsel them to have to begin to understand that they need to take charge of their own health. You know, they now begin to, some will even tell that, oh, some will even be able to know when they're about to relapse. A friend of mine who I'm managing for bipolar, recently, he knew he was about to relapse, called me that, doctor, the previous night I couldn't sleep throughout.
Realized it.
Yes, he knew it was going to happen. So I said he should let his family members get in touch with me. I'm going to tell them we were able to bring him to the hospital, you know.
Oh, nice, wonderful conversation. As a form of wrap-up, what are your final words for our guests?
Oh, I must
For our
first
viewers.
commend BIPOLAR TV for even having this program on bipolar, on the occasion of World Bipolar Day. That's one. Two, mental health awareness, the creation. I mean, what you have just done is to help create mental health awareness. There are services available for mental health for anybody who needs the service of a mental health expert or needs mental health services. Yours is to go to the nearest hospital. If you go there and they cannot manage you, they will refer you to the appropriate place. And usually, like I tell everybody when I do these talk shows, if you feel overwhelmed with whatever condition, whatever is happening, you feel overwhelmed, talk to somebody. If it's talking to your friend, somebody you can confide in. Through that, they may even provide guidance to you as to what to do or where to seek for help. Okay. Okay,
viewers, this is where we draw the curtains on our program. You can join us same time next week, 4 p.m. Healthzone on BIPOLAR TV. Salam alaikum.
Malaikum salam.
You did well.